Safety in the home. Safety in the home is an important concern for older adults. There are many factors that put patients at risk for injury. Poor eyesight and hearing, arthritis, dementia and side effects from medications are all factors that can make a simple trip to the kitchen a potentially dangerous undertaking. Injuries to older adults are more severe because of muscle weakness, brittle bones and thin skin. Caution should always be used, particularly when someone is home alone. Falls are the most common cause of fatal injury to the aged. Many accidents can be prevented by practicing good safety habits and staying alert, even when performing routine tasks. Prevention is the key to safety. It is crucial to take all appropriate measures to prevent accidents before they occur. As home health aides work, they should observe their patients and home environment for safety hazards. Home health aides must report unsafe conditions to the supervisor and the agency promptly. Common types of accidents that occur in the home include the following. 1. Falls. 2. Burns, scalds. 3. Poisoning. 4. Cuts. 5. Choking. Falls prevention. According to the Center for Disease Control (CDC), more than 1/3 of adults 65 and older fall each year in the United States. The American Geriatrics Society states that after age 75 the incidence increases. Of those that fall, 1 out of 40 will be hospitalized. Falls, even without injury, often cause a patient to develop fear of falling, which, in turn, limits their activity and affects independence. The care team can play a significant role in the reduction of patient falls through interdisciplinary communication, patient assessment, effective care practices and timely interventions that include patient-family education and evaluation of the proposed actions or safety measures. The key to a successful fall reduction program is the identification of a patient's risk factors for falls and the implementation of specific interventions to reduce the incidence of falls in the home. Home health aides play a very important role in helping patients to reduce risks and prevent fall-related injuries by proper observation and communication of the risk factors to the agency's personnel. Falls prevention. Risk factors. History of falls, hospitalizations. Age 65 and older. Medication use, including water pills, blood pressure medications, sleeping pills or drugs used for psychiatric or mood disorders, for example, antidepressants. Postoperative period. Pain. Depression. Dehydration, dizziness or lightheadedness. Low level of blood sugar. Low level of blood pressure or blood pressure drops. Visual and hearing problems. Weakness of lower extremities. Gait and balance problems. Vertigo, dizziness due to a problem with the inner ear, ringing in the ear. Mental impairment. Disorientation, confusion about person, place or time. Neurological disorders, such as Parkinson's disease, Alzheimer's disease or epilepsy. Cardiac disorders, such as bradycardia, decreased heart rate, stroke or heart valve defects. Infection, sepsis or urinary tract infections (UTI). Home environment hazards, such as clutter, throw rugs or exposed electrical cords. Improper use of assistive devices. Falls prevention. Definitions. Fall, any sudden, uncontrollable or unintentional change in body position from a higher to a lower level, coming to rest on ground or other surface, with or without injury resulting. Fall with injury, when an alteration in treatment is necessary to treat an injury sustained as a result of a fall. This excludes basic first aid, which is defined as minor treatment not requiring a doctor's order. Fall without injury. No change in treatment is necessary as a result of the fall. Fall reduction, a strategy that uses specific interventions, such as patient assessment and education to reduce the risk for falls in the home. Fall reduction program, a program that is implemented to decrease the incidence of falls and protect the patient's safety in the home. Falls prevention. Falls can be caused by a variety of reasons and circumstances, including an unsafe home environment, loss of abilities, chronic diseases and use of medications. Problems resulting from falls range from minor bruises to fractures, as well as life-threatening injuries. A fracture is a broken bone. Older people are often more seriously injured by falls, because their bones are more fragile. Hip fractures are one of the most common types of fractures from falls. Hip fractures result in the greatest number of deaths among older adults and can lead to severe health problems. Home health aides should be especially alert to the risk of falls in elderly patients. Home health aides must report all falls to their supervisor and the agency immediately and get further instructions. A patient should not be moved before the home health aide contacts the supervisor. An incident report must be completed, even if the patient says he or she is fine, and the home health aide must provide a written statement of the fall accident to the agency's personnel upon request. Falls due to environmental hazards. Poor condition of floor coverings. Uneven floors or stairs. Unsecured, throw rugs. Clutter, obstructed walkways. Inadequate lighting. Exposed electrical cords. Slippery or wet floors, water, oil, household cleaning products. Unstable furniture. Slippery bathtub. Low toilet seat. Absence of a nightlight near the bed. Chairs without armrests. Extension cords across walkways. Bathtub or toilet without grab bars. Stairs without rails. No. Bathroom assistive devices. Falls prevention. Clear all walkways in the home of clutter, throw rugs and exposed electrical extension cords. Avoid using floor polish or wax to reduce slippery surfaces. Use mats or rugs with a non-slip backing where appropriate. Place a nightlight by the bedside and have adequate lighting in all rooms. Have patients wear non-skid, sturdy shoes and make sure shoelaces are tied. Have patients wear clothing that is not too long and does not drag on the floor. Place non-skid bath mats in tubs or showers. Grab bars for the tub, shower and toilet are helpful if a patient is weak and unsteady. Place a bathtub seat or shower chair. Install a raised toilet seat if needed. Offer help with toileting often. Respond to patient requests for help immediately. Keep personal items that are used often close to patients. Immediately clean up spills on the floor. Lock wheels and move footrests out of the way before helping patients into or out of wheelchairs. Lock bed wheels before helping patients into and out of bed or when giving care. Before giving care, you will often need to raise adjustable beds to make your job easier and safer. After completing care, return beds to their lowest position. Have patients use the prescribed assistive devices properly. When possible, get help with moving patients. Keep patients' working aids, such as canes or walkers, within their reach. Have patients rise slowly from sitting positions. Encourage drinking plenty of fluids unless a patient is on fluid restriction per care plan. No. If fall happened, what to do? Call 911 if a patient is unable to lift self up. Monitor the patient for the following after a fall. Changes in the level of consciousness. Headache that does not stop. Dilated or fixed pupils. Nausea and vomiting. Report symptoms to the coordinator and the agency right away. A written statement is required, if the patient fell during service hours. Burns scalds prevention. Burns can be caused by dry heat, for example, a hot iron, stove or other electrical appliances, wet heat, for example, hot water or other liquids, steam or chemicals, for example, lye or acids. Older adults or people with a loss of sensation, such as from paralysis or diabetes, are at the greatest risk of burns. Scalds are burns caused by hot liquids. It takes 5 seconds or less for a serious burn to occur when temperature of the liquid is 140 degrees Fahrenheit. Coffee, tea and other hot drinks are usually served at 160 degrees Fahrenheit to 180 degrees Fahrenheit. Such temperatures can cause almost instant burns that require surgery. Preventing burns is very important. Burns scalds prevention. Guidelines for preventing burns and scalds include the following. Roll up sleeves and avoid loose clothing when working at or near the stove. Check that the stove and appliances are off when you leave. Suggest that the hot water heater be set lower than normal. It should be set at 120 degrees Fahrenheit to 130 degrees Fahrenheit to avoid burns from scalding tap water. Always check water temperature with a bath thermometer or on the inside of your wrist before using. Keep space heaters away from patients' beds, chairs and draperies. Never allow space heaters to be used in the bathroom. Use low settings on hair dryers. Immediately report frayed electrical cords and appliances that look unsafe. Do not use these appliances. Let patients know that you are about to pour or set down a hot liquid. Pour hot drinks away from patients. Keep hot drinks and liquids away from edges of tables. Put a lid on them. Make sure patients are sitting down before serving them hot drinks. No. Poisoning prevention. Homes contain many harmful substances that should not be swallowed. They may include cleaning products, paints, medicines, toiletries and glues. These products should be locked away from confused patients and patients with limited vision. All medications must be stored safely. Home health aides should check medications for expired dates. Part of the home health aide's job is to be sure that the patient reads the medicine labels carefully before taking a medication. If a medicine is not labeled, the home health aide should report the situation to the agency promptly. The patient's medications should be stored separately from medications taken by other members of the family. Patients who have a diminished sense of taste or smell due to stroke or head injury might eat spoiled food. Home health aides should check the refrigerator and cabinets frequently for foods that are moldy, sour and spoiled. Home health aides should investigate any odors they notice. Patients with dementia may hide food and let it spoil in closets, drawers or other places. Keep the number of the Poison Control Center handy, 800-222-1222 or call 911. Cuts prevention. Cuts typically occur in the kitchen or bathrooms. Sharp objects, including knives, peelers, graters, food processor blades, scissors, nail clippers and razors must be kept out of reach. Sharp objects should also be locked away if there is a confused patient in the home. When preparing food, the home health aide should cut away from herself, use a cutting board and keep fingers out of the way. The home health aide must also know proper first aid for cuts. Cutlery should be put away when not in use. If the home health aide is using a knife and puts it down for a moment, he or she should place it away from the edge of the counter or table, making sure the blade is pointed away from the counter or table edge. Other sharp kitchen tools should also be stored in safe places and out of reach of confused patients. Choking prevention. Choking can occur when eating, drinking or swallowing medication. People who are weak, ill or unconscious may choke on their own saliva. A person's tongue can also become swollen and obstruct the airway. Patients should eat in as upright a position as possible to avoid choking. Patients who have trouble with utensils need their food cut into bite-sized pieces. Popcorn, peanuts, hard candy, Gum and foods, such as hot dogs or grapes, are easily inhaled and may pose a choking hazard. For elderly patients with difficulty swallowing, the home health aide can serve softer foods or foods cut into smaller pieces. When the home health aide serves meals, he or she may encourage patients to take small bites of food, chew thoroughly and eat slowly. Patients with swallowing problems may have a special diet with liquids thickened to the consistency of honey or syrup. Thickened liquids are easier to swallow. Plastic storage bags should be kept out of reach. Dry cleaning and other large plastic bags should be recycled or discarded. Fire safety. It is essential for home health aides to recognize and report any fire hazards that may include the following: wood stoves and kerosene, gas or electric heaters that appear old, damaged or faulty. Unvented heaters used in small, enclosed areas or sleeping areas. Space heaters used near fabrics, such as draperies, bedspreads and towels, or used to dry clothing or towels. Flammable materials, such as gasoline, kerosene or paint thinner stored near stoves, heaters, furnaces, hot water heaters or other appliances. Frayed or exposed electrical wires. Matches or lighters left within reach of incapacitated adults. Careless smoking. Smoking in bed. Cigarettes, pipes or cigars left burning. Confused patients smoking. Fire safety. Guidelines for reducing fire hazards and responding to fires. Never work wearing loose or flowing clothing, especially around the stove. Roll up patients' sleeves and avoid loose clothing when patients may be cooking or around the stove. Stay in or near the kitchen when anything is cooking or baking. Store pot holders, dish towels and other flammable kitchen items away from the stove. Discourage careless smoking or smoking in bed. If patients smoke, check to be sure that cigarettes are extinguished after use. Empty ashtrays frequently, but before emptying an ashtray, ensure there are no hot ashes, matches or cigarette butts in the ashtray. Patients may use electronic cigarettes that do not contain tobacco. They contain liquid nicotine that is heated and turned into a vapor the person inhales or exhales. Fires with e-cigarettes occur due to the battery overcharging, overheating and infusing an unapproved power source to recharge the battery. Encourage patients use only the charger supplied by the manufacturer. Batteries may need to be removed from chargers once fully charged. Do not leave the clothes dry around when you leave the house. No. Guidelines for reducing fire hazards and responding to fires continued. If you smell gas, report it immediately. Turn off space heaters when no one is home, or everyone is asleep. Check monthly that smoke alarms are working. Replace batteries as needed. Have fire extinguishers on hand. Every home should have a fire extinguisher available in the kitchen. Do not store the kitchen fire extinguisher near or above the stove, because you need to be able to get to it if the stove is on fire. Check that fire extinguishers have not expired. Know where the extinguisher is stored and how to operate it. PASS acronym will help you understand how to use a fire extinguisher. Pull the pin. Aim at the base of the fire when spraying. Squeeze the handle. Sweep back and forth at the base of the fire. Fire safety. Fire safety. In case of fire, RACE acronym is a good rule to follow. Rescue anyone in danger if you are not in danger. Activate alarm. Contain the fire if possible, by closing doors and windows. Extinguish fire with a fire extinguisher or evacuate the area if fire is too large for an extinguisher. In case of fire, follow these guidelines for helping patients and their family members exit the home safely. Remain calm. Do not panic. Be sure all family members know how to exit in case of fire and have a designated meeting place outside the home. Do not try to put out a large fire. All household members should leave the house and call the fire department immediately. If windows or doors have locking bars, keep the keys in the locker nearby. Remove anything blocking a window or door that could be used as a fire exit. Stay low in a room to escape a fire. Do not use elevators. If door is closed, check for heat coming from it before opening it. If the door or doorknob feels hot, stay in the room if there is no safe exit. Plug the doorway. Use wet towels or clothing to prevent any smoke from entering. Stay in the room until help arrives. Use the stop, drop and roll fire safety technique to extinguish a fire on clothing or hair. Stop running or stay still. Drop to the ground, lying down if possible. Roll on the ground to try to extinguish the flames. Use a damp covering over the face to reduce smoke inhalation. After leaving the home, move away from it to the designated meeting place. Evacuation for the mobility impaired. Do not evacuate by elevator those patients who are dependent on mechanical equipment for their mobility unless authorized by the emergency personnel. Call 911. Stay with the patient until the emergency team arrives. Close as many doors as possible between you and the fire. Place a wet cloth under the door to prevent smoke from entering. Breathe shallowly through a filter, such as a shirt or towel. No. Oxygen safety. Oxygen therapy is the administration of oxygen to increase the supply of oxygen to the lungs. This increases the availability of oxygen to the body tissues. Oxygen therapy is used to treat breathing difficulties and is prescribed by a doctor. Home health aides should never stop, adjust or administer oxygen for a patient. Oxygen will be delivered to the home in cylinders or tanks or produced by an oxygen concentrator. Compressed oxygen and liquid oxygen are stored in tanks of varying sizes. An oxygen concentrator produces and distributes oxygen but does not store oxygen. The company supplying the oxygen will service the equipment and provide training on its use. Oxygen safety. Some patients receive oxygen through a nasal cannula. A nasal cannula is a piece of plastic tubing that fits around the face and is secured by a strap that goes over the ears and around the back of the head. The face piece has two short prongs made of tubing. These prongs fit inside the nose, and oxygen is delivered through them. A respiratory therapist fits the cannula. The length of the prongs, usually no more than half an inch, is adjusted for the patient's comfort. The patient can talk and eat while wearing the cannula. An oxygen concentrator is a box-like device that changes air in the room into air with more oxygen. Oxygen concentrators are quiet machines. They can be larger units or portable ones that can move or travel with the patient. They have at least one filter that typically needs to be cleaned once per week. Oxygen concentrators run on electricity. They are plugged into wall outlets and are turned on and off by a switch. It may take a few minutes for the oxygen concentrator to reach full power after it is turned on. Patients who use oxygen concentrators will often have a backup oxygen tank available in case of a power outage. Patients who do not need concentrated oxygen all the time may use a face mask when they need oxygen. The face mask fits over the nose and mouth. It is secured by a strap that goes over the ears and around the back of the head. Plastic tubing connects the mask to the oxygen source. The mask should be checked to see that it fits snugly on the patient's face, but it should not pinch the face. It is difficult for the patient to talk when wearing an oxygen face mask. The mask must be removed for the patient to eat or drink anything. Oxygen is a very dangerous fire hazard, because it makes other things burn. Working around oxygen requires special safety precautions. Guidelines for working safely around oxygen. Keep oxygen at least 6 to 10 feet away from any open flame or heat source, such as candles, a gas stove, or from anything that may cause a spark. Any type of open flame near oxygen is dangerous. Do not smoke or let anyone else smoke near the oxygen equipment. No smoking sign should be in every room where oxygen is used. Oxygen and use sign should be put on the door. Oxygen can be irritating to the nose and mouth. The strap of the nasal cannula or face mask can also cause irritation around the ears. Make sure to check the nasal area and behind the ears for signs of irritation. Report to the agency any irritation you observe. Smoke alarms should be in the patient's house or apartment. Do not use an extension cord with an oxygen concentrator. Do not put electrical cords or oxygen tubing under rugs or furniture. Do not use petroleum-based products, such as Vaseline or chapstick, on the patient or on any part of the nasal cannula or mask. Oil-based lubricants can be a fire hazard. Guidelines for working safely around oxygen continued. Oxygen cylinders should be stored in an upright, secure position, in an oxygen storage rack, in a well-ventilated area away from open flame, heat source, or direct sunlight. Do not cover them with cloth or plastic. Avoid using fabrics, such as nylon and wool. They can cause static electricity discharges. Remove all fire hazards from the area. Fire hazards include electrical equipment, such as electric razors and hair dryers, as well as space heaters, matches, cigarettes and flammable liquids, alcohol and nail polish remover. Read the labels on liquids if you are unsure whether they are flammable. If flammable, such liquids must be removed. Learn how to turn oxygen off in case of fire. Never adjust the oxygen setting or dose. Notify your supervisor and the agency if a fire hazard is present, and the patient does not want it removed. Oxygen safety. For patients using oxygen tanks, count and record pulse and respirations before and after the patient uses the oxygen tank to see if there are any changes if directed. The flow meter shows how much of the oxygen is flowing out to the patient at any time. It should be set at the amount stated in the care plan. If it is not, report this to your supervisor and the agency. Do not adjust oxygen level. Make sure that the humidifying bottle has distilled water in it and is attached correctly. Wash the humidifying bottle according to the care plan or equipment supplier's instructions. Change the nasal cannula when ordered. It will need to be changed when it is hard or cracked, at least once every 2 weeks. It should also be changed after the patient has had a cold or the flu. Wash the plastic tubing once or twice per week with soap and water and rinse it well. Make sure the oxygen tank is secured and will not tip over. For patients using liquid oxygen, turn off supply valves when the reservoir is not in use. Do not tip the reservoir on its side. Make sure the reservoir is not in a closet, cupboard or other closed-in space. Do not cover the reservoir with bed linens or clothing. When lifting the reservoir, lift with 2 hands. Do not roll the reservoir or walk it on its edge. Do not touch any frosted parts of the equipment, because the cold can cause frostbite. Do not touch liquid oxygen that also causes frostbite. Report if the reservoir is leaking. Oxygen safety. For patients using oxygen concentrators, count and record pulse and respirations before and after the patient uses the oxygen concentrator to see if there are changes if directed. The oxygen concentrator dial must be set at the same rate as listed in the care plan. If it is not, report this to your supervisor and the agency. Do not adjust oxygen level. Check the humidifying bottle each time the device is used to see that it has distilled water in it and that it is screwed on tightly. Distilled water, not tap water, must be used, because minerals in tap water may clog the tubing. Make sure that the concentrator is in a well-ventilated area, at least 6 inches from the wall. Because the air filter cleans the air going into the machine, brush it off daily to remove dust.